Topic in the government, I can't. Exactly. Here.
Om Namah Shivaya. Om Amriteshwariyai Namaha. A healthy eye gives a healthy view. A healthy view creates a healthy vision. It gives me immense pleasure to welcome you all for the most anxiously awaited occasion of the webinar, Eyes and You. This program is jointly organized by Department of Visual Media Communications and Cultural Education and India Studies. Respecting our rich tradition, let's begin the formal session by invoking the blessings of our Sadguru Amma. I invite Kumari Rishika of BSc Visual Media for the prayer.
ध्यायामो धवलावगुण्ठनवतीं तेजोमयीं नैष्टिकीं स्निग्धात्पाङ्गविलोकिनीं भगवतीं मन्दस्मितश्रीं वात्सल्यामृतवर्षिणीं सुमधुरं सङ्कीर्तनालापिनीं श्यामाङ्गीं मधुसिक्तसूक्तिम् अमृतानन्दात्मिकाम् ईश्वरी.
With great respect, I proudly invite our director, Dr. U. Krishnakumar sir, the man behind all success of our institution, to welcome our chief guest. Welcome you, sir.
Doctor, can I begin? Doctor, am I audible?
Please, yeah, I am completely hearing you, sir.
Okay. My humble prostrations at the lotus feet of our beloved Amma, Sri Mata Amrita Devi, who is Chancellor of the Amrita Vishwavidyapitham University, and people around me here. On the left side is Sri Krishna Kumar, affectionately known as Kanman, Media Department. Chandran Perumalur, Sri Ramachandran, who is the head of the Cultural Education and India Studies Department. Harikrishnan, who is behind. He is the Vice Chairperson of the Department of Visual Media and Communication. The head of the Department of Visual Media and Communication has gone home. He will be joining online. He is from Tamil Nadu, Dr. Dinesh Babu. Let me try to introduce in the most simple way the rich profile of Dr. Gopal Pillai, who is presently heading our Department of Ophthalmology at the Amrita Institute of Medical Sciences and Research Center, which has become one of the most foremost among the medical institutions, teaching hospitals, and an international research center in more than 50 areas of medicine. AIMS is now well known to everyone all over the world. And we are extremely fortunate that Dr. Gopal Pillai has been with AIMS since 2005, and the contributions he has made to the AIMS and the development of the Department of Ophthalmology is incredible. Dr. Gopal Pillai is a proud son of a proud doctor and orthopedician, Dr. K.S. Pillai from Trichy. By son of a famous doctor, Dr. K.S. Pillai, who has treated me. After 25-30 years, I came to know about it. And I had the opportunity to meet him once about 5 years back. Is Dr. K.S. Pillai. My humble pronouns to Dr. K.S. Pillai first, because it is traditionally I have to welcome him first. Dr. Gopal Pillai finished his MBBS from Calicut Medical College in 1996. In 2000, he finished his MD at the Dr. R.P. Center, AIMS, All India Institute of Medical Sciences, New Delhi. He went on to do continuously his studies. The sojourn of learning did not stop. Even now, he is a learner. He is a student of ophthalmology. 2001, he finished his diplomate at the National Board of Medicine, the DNB Super Speciality. He finished in 2002 in FICO. 2003, he was qualified for FRCS. Currently, he is a professor and HOD of the Department of Ophthalmology and also heading the Vitreoretinal Services at the Amrita Institute of Medical Sciences. He has more than 10 international publications. When you say international publications in medicine, they are of really international standards, having high impact on the medical domain and the international medical community. National publications, he has more than 35. International presentations, he has made innumerable number, more than 30 presentations he has made internationally. National presentations number more than 350, and the public presentations for which he is very famous, but he doesn't get time, limited that we are staff and richly towards the community of students who are learning ophthalmology through chapters and textbooks. And prior to joining the AIMS, he had the humble career of 2004 to 2005. He joined as a senior consultant at the Chaitanya Eye Care. 2005 to 9, he started his career in the AIMS Kochi as assistant professor. 2009 to 2018, he served as associate professor. 2018 onwards till date, he has been the professor and head of the Department of Ophthalmology. Also, he contributes heavily towards publications and writing and reviewing, and he is editor of the famous journal KGO. He is also a very good organizer, and he has been serving as the organizing secretary of KSOS, the Drishti 2016 onwards. He is a reviewer of Ophthalmology, the Journal of American Academy of Ophthalmology, which is one of the most foremost, the most famous among the ophthalmology journals. Reviewer of Saudi Arabian Journal of Ophthalmology, and he is also the reviewer of Journal of Tropical Medicine. These are some of it's only a nutshell of what I have presented is rich. And I that disciplines me for the IQAC. So that also I am proud to say. His entire team, Dr. Basha, all the others whom I know very closely, we have collaborated with Dr. Gopal Pillai, especially the visual media department has collaborated many times during many other projects which I am not mentioning here. And let me pray to Amma to bless Dr. Gopal Pillai for this as a service to his alma mater as well as the alma mater of Amrita Dept and for the whole community of the society, because this is not purely academic, this is a societal service also. And let me pray to Amma to bless him and his family. And with this, let me humbly introduce Dr. Gopal Pillai, and on behalf of all of us who are attending, a most humble pranams and hearty welcome, Dr. Shivaya.
Namaskar, sir.
Thank you, sir. With great pleasure, let me invite Dr. Gopal S. Pillai, sir. Sir is the professor and HOD of Department of Ophthalmology, Amrita Institute of Medical Sciences, Kochi. Sir is a great devotee of our Sadguru Amma and also a member of our Amrita family. Welcome you, sir. Over to Dr. Gopal S. Pillai, sir.
Thank you very much, sir. I hope I am audible.
Yes, very much.
Yeah. Thank you very much for your kind introduction, sir. Whenever I come to Amrita College of Arts and Sciences, it is just like I am in my own place. The warmth that you all exude towards your sister institution, Amrita Institute of Medical Sciences, and its doctors is awesome. And just want to tell you that we had some wonderful collaborations with Krishna Kumar sir at the and other people in the visual sciences area, where we actually created maybe about 15 or 20 videos on social issues like corneal blindness and diabetic retinopathy and stuff like that, which we definitely want to continue forward. So we need to make small short videos which will touch the lives of a lot of people who are living around us. That is what is most important. As students of arts and sciences, you are also in the ഒരു ജോലി കണ്ടുപിടിക്കാനുള്ള ഒരു തന്ത്രപ്പാടിൽ ഓടുകയായിരിക്കാം. പക്ഷേ ആ ഒരു ഓട്ടപ്പാച്ചിലിനിടയിലും ചുറ്റുമുള്ള സാധാരണക്കാരുടെ ലൈഫ്സ് ടച്ച് ചെയ്യാൻ പറ്റുകയാണെങ്കിൽ that actually is really great. And hospital is a place where we see a lot of those people, and definitely you will be able to contribute by collaborations with us. എന്താന്ന് വെച്ചിട്ടുണ്ടെങ്കിൽ നമുക്ക് ഓരോ പേഷ്യൻസിന്റെ നീഡ്സും അറിയാം. ഈ നീഡ്സ് പലപ്പോഴും നമ്മളെ സംബന്ധിച്ചിടത്തോളം ആസ് ഡോക്ടേഴ്സ് വി ക്യാൻ ഓൺലി ടെൽ ദം, whereas as visual media students or as മറ്റ് പല ഡിപ്പാർട്ട്മെന്റ്സിലുള്ള സ്റ്റുഡൻസിനും you can actually do creative work to actually touch those lives. With this short introduction, I will, may I, with Krishna Kumar sir's permission, can I just go into my presentation?
Yes, sir. No problem. Yeah. One thing I forgot to mention, why I chanted the Dhyana sloga was because it contains Snigdha Abhangam, which means compassionate looking eyes. Abhangam means eyes. And this is a compassion which you are covering on the entire community.
Sir, so let me. Sir പറഞ്ഞതുപോലെ eyes can show compassion, eyes can show anger, eyes can show sorrow, eyes can show happiness, eyes communicate even without talking. You would be surprised to know that 70% of our integration take place. All our activities, thought processes, philosophies, all these integration takes place in the brain. And about 75% of the brain is devoted for the eyes, these small eyes. Okay, that's a very, very important thing. See, the vision is basically by the occipital cortex, which is behind. Where should I move my eyes to look into people is basically in the frontal area. When I see Krishna Kumar sir, I know him as the the director of the Amrita Arts and Sciences, and I have an interaction with him for so many years. My experiences with him, all these are there in my association areas, which are in the temporal and parietal areas. Your memories, which you come in as visual memories, are in the parietal area on top. So you understand about 75% of the brain is actually devoted to vision or visual association areas. No wonder we say eyes is a window to your, not just your mind, but your soul. So there's a very important thing. Now, moving on, all of you are into adolescence or young adulthood. All right. So it is important for you to know that there are a lot of changes and problems which occur all through the body and definitely in the eyes. Because as we grow, there are bound to be some changes which are there, in all organs of the body, and the eye is no exception. There are some unique visual disturbances commonly linked with puberty, but some people may have these problems a little later also. So we should know exactly how the eye works, what are the common problems, and what are the solutions. The first solution of any problem is knowledge. And you should understand that knowledge is power. Don't think that you are studying for passing the examinations. That you will pass. If you don't pass this year, you will pass next year. And 30 years down the line, it really doesn't make a difference whether you have passed the examination in 3 years or 4 years or 5 years. Really, it doesn't make a difference where you are, the stature you are in at that time. But what would be more important is your knowledge about the whole thing, about everything. So please understand, my dear children, that knowledge is power. It is not to pass the examination. And definitely, as you say, over a period of time, this knowledge and education has to transform itself into wisdom. And wisdom is another state of mind. It's a little different from knowledge. I think that is altogether another area. I would not want to go into that, but just think that your knowledge is not for passing exams, but for life. Moving on, let us just look at the anatomy of the eye. Whenever we talk about any particular organ in the human body, we want to first tell you how it looks like. Okay, the eyes is a very precious organ as far as the God has created. Eyes is a very precious organ. It has its own cover, like the lids, which will close and open. It has a protective cover. Do you know that hands have a protection? No. Hands, legs, chest, even brain has a protection. Definitely, there is a skull which is very tough and thick, but eyes have this protection which can close and open. That is the lids. Lids are an area where you give a lot of beauty. Beautiful eyes one part of the beautiful eyes come from the lids and the eyelashes. Many of the girls doing a lot. You see, that is a protective covering, and then we have the eye per se. Let us akin the eye to a camera, because a lot of you people are attuned to camera functioning. Camera has a lens. Just like that, eye also has a cornea which is completely transparent. From the cornea here to the retina here, the whole place is transparent, which will let the light go in so clearly. Okay, so the cornea, which is the most anterior-most structure here, anterior means most frontmost structure here. Then we have the anterior chamber behind it. Then we have a shutter. Just like a camera has a shutter, we have a shutter here, which is called the iris. And the central opening in the camera is called an aperture, and here it is called a pupil. And then on just behind that is a lens, and behind that is a vitreous, and then we come onto the retina. And from the retina, all the information is converted into electrical signals, and that goes into the brain through the optic nerve. So if you are looking at this particular thing as a camera, here is the lenticular apparatus. This is this iris and the pupil. They are the shutter and the aperture. And behind here, the retina is akin to the film in a camera. Okay, so you can just see how God has created the eyes, or rather, man has copied from the eyes to make the camera. So this is the anatomy of the eye. And now let us look at a very common problem. Okay, so if I were to be there, I would just ask you, how many of you are wearing a lens? And I'm 100% sure that about 50% or 60% of you would raise your hands. Basically, why? Because you have what is called, including the cornea and the lens, are basically useful to focus the light onto the center of the retina. And if that focus does not occur right on the retina, if it occurs in front of the retina, that is called a short sight, otherwise called myopia. And a lot of our children are myopic, and the myopia, the incidence and prevalence of myopia is increasing through the years. Why is it so? Because children, probably Krishna Kumar sir in his childhood would have played outside, whereas you are doing some mobile gaming or internet gaming. That is the basic difference. Yeah, so when people were moving out and playing out in the open, there used to be a lot of us used to look at distance, to focus on distances, whereas now lot of us have moved into small mobile onto which you are concentrating. Now we are all into this online classes. So many of you are attending online classes or mobiles or tablets or small places where your eyes have actually become very much focused for very near distances. This increases myopia. This discovery was made basically in Chinese and probably in Singapore children, where their near views, they were made into bookworms because there was not so much space and all. A lot of kids were made to the Japanese, the Chinese, they were basically made to read small print or look at the electronic devices. And over the last 20 years, the short sight has increased tremendously. And that is basically because all the children from young ages are so much addicted towards mobile or tablets or any visual forms like even TV. Okay, so if you allow your children to move out to the nature and play outside, then the myopia will come down. And if you make them more bookwormish, or right now, what would you call it? It's mobile addicted, then more of short sight will come. Short sight is a common problem wherein we will not be able to see significantly for distance. Now, as I know, about 50% of you will be myopes, and if you remove your glasses and look at a distant object, you would not be able to very clearly see it. The moment you put your glass, then the distant object would be clear. And for you, even if you remove the glass, your near vision is going to be very good. So when you are having a lot of near vision activities, your myopia is what increases. Now, how do you treat myopia or hypermetropia? You basically have to wear glasses. Why is it that most of you who are wearing glasses either have myopia, which means you have minus numbers, -1, -2, -3, or even sometimes astigmatism of 0.5 astigmatism, 0.5 cylinder, 0.75 cylinder, etc. Why is it that if I ask you your power, there will be hardly 5 people in this class of 300 who have hypermetropia? That is basically because you have an autofocusing mechanism of the lens. And the plus power can be generated by your intraocular muscles. The muscles which actually generate enough plus power, and the lens will become more globular. The lens will become more plus. So even if you are hypermetropic, our body's muscles, that muscles is called ciliary muscle. The ciliary muscle will contract and actually make the eye hypermetrope. Thereby, you don't have to wear glasses. But in a hypermetropic person who is using his muscle power to generate the plus lens to actually correct his hypermetropia, if he reads or if he uses near vision for a long period of time, like 3 hours continuously, 4 hours continuously, like you are having an exam, then a lot of them may have an eye strain. So how do you know that you have a refractive error? Okay, I will tell you an experiment which you can do. Okay, I'll tell you an experiment which you can do. Okay, so these are very simple things that you can do at home, and you can also help your elders in the process, or younger children also in the process. That is what we require, right? So what you have to do is make a small pinhole. Okay, take a small cardboard. Okay, not very thick cardboard, thin. It should not be just a simple paper, but a little thicker paper. Okay, like a magazine cover or something like that, and use a pen to make a small opening right in the center. Okay, make an opening right in the center. Okay, and just widen that opening a little bit. Now the opening should be less than a millimeter in size, about 0.8 millimeter in size. Now you put a calendar somewhere. Okay, now you move back and close one eye and see which at how much distance from the calendar you are clearly able to see the letters. Okay, look with the right eye, look with the left eye, and see whether there is any difference. Okay, now you put the pinhole. Now you have to move back till you are not able to see the letters properly, and then use the pinhole and see through the pinhole. If improves through, if your vision with the pinhole or without the pinhole is the same, then you do not have any refractive error. You can use the same technique to actually find the vision of your grandparents and your brothers or sisters or younger kids in the family. So it is very important to find out any large refractive error before 5 years of age, because in the initial 7 years of age, you will have brain development, which is moving at a very rapid pace. And since about 70% of the information needed for brain development is actually given by the eyes, if a small kid has a refractive error which is uncorrected, which means there is a poor vision for the kid, the brain development itself can be abnormal. And after 10 or 12 years of age, that can never be corrected. So it will be a great service if you can use this technique of putting a calendar somewhere and just moving back and check your own visual acuity, see with the pinhole if you are improving. And if you are not improving, that means your vision is perfect and good. And that is a gold standard in your house. Compared to you, see what is the vision with respect to your elders as well as your children. And probably some of the elders with cataract or some other problems, I would think that they will have to move much forward than you to see the figures in the calendar. So this is a simple experiment for you to do at home. Check the visual acuity based on a calendar. Use a pinhole to find out if you have refractive error. Get in other people in your family to do that. Use a pinhole in them, and probably using a pinhole, they can probably walk back, and the distance between the calendar and you can increase. You should understand that those are the people with refractive errors. Okay, so that is a simple experiment that you can do at home to actually be of help to the society as well. And yes, if you have an uncorrected refractive error, when you are into more, in your age, if you have an uncorrected myopia, you cannot see for distance. If you are sitting at the back of your class, you cannot see the blackboard clearly. If you are sitting in the front of your class, yes, you will be able to see the board, blackboard or whiteboard or electronic board, whatever you are using right now. So as you move back, your visibility reduces. If you have hypermetropia, which I said would be probably corrected by the muscle power of ciliary muscles, or if you have an astigmatism, which is uncorrected. What is an astigmatism? Astigmatism is a refractive error wherein the vertical beams are different from the horizontal beams. The horizontal beams come into focus at one area and the vertical beams come into focus on another area. So you require for different axes, for 90 degree, you may require one power. For 180 degree, you may require another power. And that is what is called astigmatism. So if you have an astigmatism or hypermetropia, which is you will start getting eye strain. Muscles are overacting in order to provide that refractive correction for you instead of wearing your glasses. All right. So it's easy to pick up refractive errors. All what you require would be a calendar and a pinhole. And in your case, if you read and you get eye strain, there is some problem that you have to be looking at. Now, coming to solution for refractive error, spectacles sometimes are a necessity. Basically, because you see, I am wearing this spectacles. Why? Because for me, distance power is not there. As I told you, we have an autofocusing lens mechanism in our childhood. But as we cross 40 years of age, probably the muscles which actually maintain the autofocus of the lens actually become weak. And so my autofocusing for distance is all right, but for near it has become weak. And so I need to use this glass to neutralize that power change for near. That is called a presbyopia. മലയാളത്തില് വെള്ളെഴുത്ത് എന്ന് പറയും. ഈ വെള്ളെഴുത്ത് എന്ന് പറയുന്ന സാധനം നമുക്ക് ഓവർകം ചെയ്യാനായിട്ട് പ്ലസ് ലെൻസ് വെക്കേണ്ടി വരും. അതുപോലെ തന്നെ a lot of you myopes may require to have glasses. All of you astigmatism, all of you who have astigmatism also will require glasses. So glasses actually correct the refractive error. And in cases of hypermetropia or astigmatism, we would use these glasses so that the eye strain on reading can be avoided. Amblyopia is otherwise called lazy eye. I told you that it is very important for you to check the visual acuity of young children at about 4 years of age or 5 years of age. As soon as they learn A, E, E or ABCD, you should basically have a visual acuity test for them. Why? Because as I said, 70% of the information to the brain comes from the eyes. And if eyes are poor, then the brain development itself gets reduced. And when the synapses between the eyes and the brain actually get reduced, what will happen is the visual acuity permanently reduces. Now, after 7 or 8 years of age, even if you give the correct refractive error correction, it will not improve your vision. So in a child, it is important to find out what is the refractive error and correct it, and at least 2 years is given so that the brain development is all right. So if there is a kid at 5 years or lower, check the visual acuity, correct the refractive error so that permanent visual loss because of lazy eye can be avoided. All right. I do not wish to go further into prisms or strabismus, which is highly technical, but you should understand that glasses have different size, color, and it can be your style statement. Okay. But why wear glasses? Some people think that ഒരു കണ്ണാടി വെച്ച അത്രയും ഭാഗത്ത് വൃത്തികേട് മാറിക്കിട്ടി. Whereas other people think that no, that's not enough. It's not stylish enough. My eyes are so beautiful, and I don't want it to be seen through these glasses. And I need to have an unblemished visualization of my, or other people should get a wonderful visualization of my eyes because my eyes are so expressive. It is so emotionally attuned to other people's connectivity. So that is when people start using contact lenses so that you don't have to wear the glasses. Contact lenses are very, very commonly used in myopia, astigmatism, etc. But there are certain diseases of the shape of the cornea, like cornea becoming more conical, like that is called a keratoconus. So in those cases, you may require contact lenses, definitely, because with glasses, those people will not improve in vision. And with contact lenses, there will be an improvement of vision. So generally, a general statement is that contact lens is a sort of a personality enhancement tool. It's a cosmetic device. But in some cases, you will require contact lens for treatment. Okay, I want to tell you the story of my professor, one of my professors called Vijay Kumar Dada, who was considered a very poor surgeon. Okay, he was considered a very poor surgeon, and the then head of the ophthalmology, the director of RP Center of Ophthalmology at All India Institute of Medical Sciences, told this Professor Dada, you don't come to the operation theater, you go out. You are not good enough. Okay, because at that point of time, the hierarchy used to be so strong that you could say like that. Now, if Krishna Kumar says something like that to one of the faculty, it wouldn't go down well. At that point of time, maybe 30 years back, it used to be very, very severe hierarchy. And then this poor man went out. And then even on top of that, what happened is this director, he asked this man to go to a peripheral center and work. Peripheral center in Haryana. From Delhi, he would every day travel to Haryana in a bus and then come back in the evening for 14 years. That was his vanvas. And then he was given the portfolio of contact lenses. Our then president, Yanni Salesing, had a problem in the eyes. It is called a bullous keratopathy. So it was so painful. The cornea was edematous. Edematous means swelling occurred, and there used to be severe pain. If he cannot see light, he cannot have some wind going into his eye, it will be severely painful. So Gianni Salesing called up the All India Institute of Medical Sciences and asked, who is the guy who is leading, who is basically dealing with all these problems? And then somebody said, there is a contact lens which you can place, and was put into the picture. He gave the soft therapeutic contact lenses to the president of India. And after 6 months of terrific, significant agony in his life, he could not sleep for 6 months. And that night, he slept peacefully with the soft therapeutic contact lens. Overnight, Dr. V.K. Dada was, a celebrity, treated the president of India of an incurable condition. In the next year, he was promoted to the director of the All India Institute of Medical Sciences Ophthalmology Division. And you can think what has happened after that. That's the power of a contact lens. Okay, so just sidelining about a story, but now I want to tell you that contact lenses require a lot of responsibility. Contact lens is a foreign material. Any foreign means not US or Dubai or China. It is like it is not made from our human body. Any foreign substance is not tolerated by the body, especially if it is put onto a mucous membrane. Those of you who are using a contact lens can know that if you put a contact lens, there is a little bit of element of, initially at least, you may feel a little out of place because you have put something into your eye. And the body doesn't generally like any foreign substance being put into the eye, into the body. So it will try to reject it. So your use of contact lens has to be limited in terms of time. Because if you use it for a long period of time, there's going to be a lot of problems which can occur onto the cornea. Or if there's a tight contact lens, or if you go to a party wearing a contact lens at night, you come home and sleep with the contact lens inside, a lot of problems can occur. And contact lens use is basically a causative factor for corneal ulcer, which is a major problem of the eye, a blinding problem of the eye. So if you are using contact lens, you have to be careful. You have to use responsibility. You have to wash your hands and then only touch the contact lens. Remove the contact lens carefully, put it to the contact lens soaking solution, and the soaking solution needs to be replaced. So a responsibility is very important if you are using contact lenses. What is LASIK or laser vision correction? Okay, so it can be used to correct myopia, hypermetropia, astigmatism. We have LASIK at Amrita Institute of Medical Sciences. So if any of you want to actually remove your glasses and not be a slave to the contact lens every day, then LASIK is a good option. What we do is, the cornea, which is the topmost layer of the eye, is about 550 microns in size. We will make a small flap at about 180 microns. And then we have the rest of the 350 microns. We will do the laser to reshape the cornea to correct the refractive error and put this flap back. This takes roughly half an hour for both eyes together. And this is if you select yourself correctly, then this will be something which for the rest of your life, you would not require glasses for distance. There are some other conditions which are commonly seen. One of the important condition would be a stye or a hordeolum. You can see that. Can I just take a second? 1 second. Yeah, sorry. Another important problem that we can have is hordeolum or stye. It's just an infection in the lid margin. All right. So lid margin has small glands. Or if there is a skin issue which repeatedly causes infection, this is a common problem. And some of the children who have uncorrected refractive errors also have this hordeolum. So hordeolum is an infection of these small glands, sebaceous glands in the lid of the eye. And how can we prevent it? Less your oily food intake. Clean the lid margins. lid margins can be cleaned with a little hot water. So that can prevent the hordeolum and eyes, etc. Another common problem which many of you would have experienced would be conjunctivitis. Conjunctivitis is a very, very common problem, especially in schools. Now, if one child has conjunctivitis, then the whole class will get conjunctivitis within 2 weeks. And then usually conjunctivitis is infection of the conjunctiva and it limits itself to that. But if conjunctivitis, the infection, the viral infection or the bacterial infection invades the cornea, okay, conjunctiva is just a covering. Even if there is an infection, nothing will happen. But cornea is a very vital structure through which light passes in, and it is completely transparent. If there is any problem to the corneal transparency, the vision drops down. So conjunctivitis needs to be treated so that the infection doesn't come into the cornea. So if it comes into the cornea, then your vision may get affected, and it may take a long period of time for that affection to just go away. Some of the viral conjunctivitis which involves the cornea is called a keratitis, and it may cause permanent decrease of vision as well. Some children with allergic asthma, allergic itching, they can have allergic conjunctivitis as well, in which they have a lot of itching all the time. And it may be seasonal also. At some point of spring or autumn or rainy season or summer season, some people may have this and that. So some people may have allergy to dust in the house. Some people may have allergy to pollen grains. Some people may have allergy to some insect related droppings. So different people may have allergy to different things, and the common symptoms would be itching and significant redness of the eyes. Dry eye is a very, very common problem. Okay, so again, as I told you, a lot of you have moved into computer screens or tablets or Kindle or mobile or all the electronic equipments which we are using on a regular basis. And a lot of you will be on social media, and you will be on social media for 3 hours to Facebook, your WhatsApp, chatting, your Instagram. You have to manage all these things together. So even if you give half an hour to one social media, then fortunately TikTok is banned. But now it's coming back, it seems. TikTok is taking steps to come back, it seems. Okay, so these causes what is called computer vision syndrome, otherwise called dry eyes. So when you are staring at the computer for a long period of time, what happens is your brain is so absorbed that you will forget to blink. You will continuously look like this without blinking. What happens is that the tears will evaporate. Even then you will not blink. Blinking means a little bit of information has to be forfeited. No, I am not going to blink. So that is what the brain says, and you will keep on staring at your screens till it becomes completely dry and it becomes desiccated like this. Okay, so that is what will happen. So these are some of the contact lens related complications which I wanted to show you before. Corneal involvement. So I don't want to frighten you much with contact lens related problems, but these can occur if you are irresponsible. So before moving on, I just want to spend one more minute here. This dry eye or computer vision syndrome. We should know how to manage a computer. Number one, your screen time should reduce. See, somebody runs for 15 hours a day and complains to the doctor that, sir, I have got some leg pain. The orthopedician will say, you are running for 15 hours and you are complaining of leg pain. That is bound to happen. You are only designed for running only this many hours a day. Like that, your computer screen is maximally possible for about 2 hours a day. But unfortunately, many of our jobs are in such a way, the software jobs and all, you are on computer screen for nearly 12 hours or even more. And that is abnormal. And when you are using your eyes on the computer for 12 hours, definitely you cannot prevent this dry eye or computer vision syndrome or mobile vision syndrome. So what we have to do is every few seconds, you need to close your eyes, You need to you look out through the window to a greenery, wash your face, take your water, move around the area, come back, again work. Voluntarily close your eyes and open every 20 seconds. Voluntarily close your eyes and open. Keep some greenery on your table to which you can see, because greenery actually cools down your eyes a little bit. Okay, and maybe if you are seeing flowing water somewhere, that is why a lot of flowing water tabletop preparations are now available. That also gives you some cooling effect. All right, so let us move on to some of the retinal pathologies. As I said, myopia has a lot of problems. Macular hole, retinal detachment. See, retina is the back of the eye, which is just like the film in a camera, and you can have the film detach or dislocate from its position. Just like that, you can have a retinal detachment. You can have holes. That's called a macular hole. Then you can have diabetes inside the eye, which can cause diabetic retinopathy and actually cause loss of vision. So a lot of these retinal pathologies will cause permanent loss of vision. So you can see that there are inflammation in the body which can cause loss of vision called uveitis, even leukemia, lymphoma. So I want to tell you that looking at the eye, you can find a lot of problems which are there inside the body. Okay, as I said in the beginning, eye is a window to the soul. Eye is a window to the health of the body as well. Retina is the only place in the whole body where you can actually see the blood vessels, the arteries, the veins, the internal milieu in which it is bathed, the optic nerve. We can see the nerve. So this is the only place in the whole human body where you can see the vessels, the nerves, and the internal milieu. So any problems with vessels, can I tell you some problems with vessels? Hypertension, diabetes, vasculitis, some other very, very difficult diseases, hemoglobinopathies, you know about anemia, polycythemia. So a lot of diseases in which blood is involved, blood vessels is involved, you can actually pick up from the retina or the eye. These are some genetic diseases which occur. And so we basically look at causes of genetic diseases which can also be picked up. Okay, so this is computer vision syndrome, which I touched upon earlier. It is not just computer vision syndrome. It is about your whole posture. So when you are on the computer for 12 hours, your neck takes a toll, your back takes a toll, your elbows, your fingers, all these take a toll. So accurate positioning and your ergonomics on the computer table has to be very good if you want to have longevity. Longevity is a very, very important concept. It is not about longevity today. It is about longevity across the years. And unless you treat your body correctly, you will not have that longevity. Will you not service your bike or your car every maybe 6 months? Every 6 months, the service center will call you and say, sir, your time for service is there. And such a small thing which you are using for 10 years, you are servicing every 6 months. This is the body which you are going to use for the next 100 years or maybe next 80 years. All right. You need to service it properly if you want to have a longevity in terms of that. This is again dry eyes due to computer vision syndrome. So the tear film gets abnormal. So as I said, blinking properly, moving around, washing your face, pouring water, seeing greenery, all this is very important. And sometimes you may have to use some tear substitutes for that. So now childhood blindness is the next big area where vitamin A deficiency. Now Government of India has given vitamin A program. Do you know which country had the first blindness control program in the world? It is not USA. It is not UK. It is not any European country. It is India. Okay, it is something that we need to be proud of. The world's first blindness control program was initiated by the Indian government. All right. So these are some childhood blindness and genetic disorders which you need to take care of. You all have your parents and grandparents, and so you should know that during aging, there are a lot of problems. I told you there are a lot of changes which occur in adolescence, but now in aging, there are a lot of problems which can occur. One would be presbyopia, as I said, glasses can be a simple solution. Cataract may require cataract surgery. There are conditions like diabetes, which over 20 years can cause diabetic retinopathy. As age increases, you can have age-related macular degeneration and then glaucoma. These are all conditions which are silent killers. They will basically steal your eyesight without you yourself not knowing. And unless you check for this, you will not find out. I want to bring in two concepts here. One concept is about a reversible loss of vision and irreversible loss of vision. Okay. Now, cataract is a typical example for a reversible loss of vision. There is cataract, you operate the cataract, you get back the vision. Whereas many of the retinal diseases like diabetic retinopathy, age-related macular degeneration, and also glaucoma, which is pressure inside the eye, which is increased, they are irreversible loss of vision. Number two concept is about time-sensitive treatment needing diseases and time-insensitive treatment needing diseases. Like, for example, in a cataract, now we have corona all over the place. And so your grandfather doesn't want to get into a hospital to operate a cataract surgery. Nothing will happen. Even if you operate 1 year down the line, 2 years down the line, in majority of patients, nothing is going to happen. Whereas we have a diabetic retinopathy or an age-related macular degeneration or a glaucoma, they are time sensitive. If you do not treat it now, today, this month, you will permanently lose vision. So, top 10 tips: eat healthy. More number of colors in your food, not added colors. Natural colors in your food stuff, the better. Have red, have greens, have blacks, have blues, okay, have yellows. So more the color, natural colors in your food, the better. Adequate sleep, 7 to 7.5 hours. Very important, 7 to 7.5 hours. And in younger people, you are people who are studying. So your sleep times maybe 6.5 hours, etc. Maintain proper hygiene. Wash your face. Your lid margin you need to clean. Regular eye checkup. Maybe at 5 years of age, 4.5, 5 years of age, as soon as you learn to read the alphabets, it's a good idea for everybody to check the vision to see if there is any refractive error. And if there is any refractive error, you need to clean it up, come and correct it. And then maybe in young adulthood, maybe at 40, and then maybe 5 years down the line, every 5 years. After 50, 60, it should be a yearly checkup. Quit smoking and liquor. Okay. Wear sunglasses if you are going out, because ultraviolet rays actually damage the retina. Exercise is actually very good. Rest your eyes while at work and avoid the over-the-counter medicine. Some people, they say, okay, this is good, that is good. But you see, many of these just sting the eye, that is all. And keep a safe distance from electronic screens and keep a safe time also for electronic devices. When to get help? If you are unable to focus on faraway objects or objects which are close up, if there's frequent eye rubbing, if you're looking at light, you find that it is very sensitive to light, excessive tearing or lacrimation. If you close one eye, you are getting better with your vision. Eye strain, headache, tired eyes, and constantly getting low grades than usual in your exams. Basically, you should also check out eyes. And there are different ways to get it. I think every 5 kilometers there is an eye hospital which you can check up. And with that, I think we can stop it here. I would be happy to answer any questions from anyone.
Thank you, sir. Dry eyes and tips. As mentioned in the invitation, all what you want to know about eye care. Thank you, sir. Dear students, you can ask any question or doubts related to eye care to our chief guest.
Participants, please ask questions. Many of you may be already undergoing some eye treatments and eye care procedures, but still they can also ask questions.
I think very specific questions will require examination of those children. So I think you should be asking generalized questions like, don't tell me I have this problem, I have been going to the doctor, and how good is that doctor? Please don't ask me such questions.
Ushagra, you are asking something?
Yes, sir. Namaskar, sir. Namaskar. Sir, I have a question. Sir, my name is Kushagrita.
Okay.
Yes, sir.
She is
Sir,
a
I have
daughter,
a question.
younger daughter of.
Yeah, she is Vishal sir's daughter.
Yeah.
Yeah. Great, sir. Great. Yeah.
Sir, I have a question regarding the, sir, like you said, dry eyes because of the pandemic. We've been constantly watching, been on the screen and classes. Sir, can you tell us doing the online classes? So just cutting down on screen time is difficult.
Yeah. I think a lot of these classes have audio visual content. Okay. So that means you require to also see the computer and also hear the teacher. Even the class that I took, I had audio visual content. So when you have audio visual content, you are forced to actually look at the screen as well. But when you are at the screen also, definitely bring in some bottle of water and sit near a window. Make sure that the light is not directly hitting the computer screen and then reflecting onto your eyes. So make sure the lighting in the room is appropriate. Reduce your screen brightness and contrast sensitivity to a level which you're comfortable with. Every 20 seconds or 30 seconds, voluntarily close your eyes for a second. Maybe, stand up, stretch, in between, maybe offing your video in between. You can stand up and stretch, etc. And once in a while, you just go around the room, stretch your hands and legs, maybe do some flexion exercises and come back and sit, probably drink some water, look out through the window to some greenery far away, and close your eyes. Okay. And don't let the fan directly onto your face, because fan or AC directly onto your face also creates dryness. So these are some, and maybe wash your face, maybe after each 40-45 minutes, you can wash your face and sleep nicely. So these are some of the tips that you can use. Vitamin A containing foods include carrot and radish and beetroot and some of these things. So you can take them. They will also help you in preventing dry eye. I hope it is okay.
Thank you so much, sir. Yes, sir. Thank you so much, sir.
Namaskar.
Namaskar.
Actually, my daughter has astigmatism, and you said it cannot be corrected, but I find that her eyesight is improving. Also, they say that there is treatment in Ayurveda as well as, Aurobindo Ashram. There is a hospital called the School for Perfect Eye. These two, that is, medical treatment can be given to astigmatic children, and there are a lot of results. So why did you say that it cannot be improved? Because according to the doctor, my daughter's eyesight has improved.
Yeah, that's a very specific query. So if you are asking me whether astigmatism will improve, all right?
Yeah, the power can be increased. The vision can be increased. That's what I feel. and you said it cannot be. The child is, of course, wearing specs now, but there is a variation in her power. It has actually improved.
Mhm.
So, is
See,
there a
see,
chance
I,
for her to get rid of specs?
yeah. So let me come to the scientific part of this. Okay, and astigmatism means that the vertical rays of light and the horizontal rays of light are focusing at different parts of the retina. One in front of the retina and one behind the retina. All right. So there is a shape abnormality. There is a. Can you hear me?
Yeah, I can.
Yeah. There is a shape abnormality of the cornea, or there is a shape abnormality of the eye per se, which causes this particular problem. All right.
Yeah.
Can you reduce somebody's height by taking some tablets?
No, we can't.
Yeah. You can make somebody a little fatter, but or thinner, but generally you cannot. You can you like somebody is destined genetically to have 5 foot 5 inches height. Can you make him 6 foot 3 inches by giving some tablets? No. So the shape of the eye would not basically change with any tablets or anything. But your muscles can overact. As I said, your muscles can act and can compensate for some refractive errors. All right. So if you can compensate muscle power, okay, which is basically some of the exercises that people do, and if you can compensate with that, that is a short-term thing till about 40 years of age. And if you are using muscle power to compensate for refractive error for a longer period of time, all right, so they will develop what is called eye strain or anopia. Now, I did not say that astigmatism will lead to complete permanent loss of vision. I said that uncorrected astigmatism or uncorrected high refractive error will reduce the clarity of images that go into the brain, and thereby it will reduce the synapses. All right. So that is what I said. Okay. So it is not that astigmatism per se will lead to loss of vision or anything like that in a child. Astigmatism can be easily corrected, and astigmatism can be easily corrected without glasses with contact lenses. Astigmatism can be permanently corrected with a LASIK or a refractive surgery. So there are a lot of treatments for astigmatism, and who said there is no treatment for astigmatism? All right.
So
So
the
what
child
I
has to
said is,
continue wearing specs, right? The child has to continue wearing specs.
what is the
According to
age of
you.
your child, please?
She's 10 years old.
She's 10 years old, and she had how much astigmatism?
I don't remember her past.
Yeah. So madam, it is like this. If we need to go into a specific case, we need to know a lot of things. So
Okay.
you know what your doctor has told you, and as a
Yeah.
doctor, now let me tell you that a cancer patient is going to come to me and he's going to die in the next 3 months. I usually won't tell like that. I will sugarcoat the whole thing and say that there are some problems. Let us see. Let us move on and see. Now let us treat. This is how all the doctors say. So if we want to actually go into the depth of your personal question, I need to look at how much was the astigmatism before and how much was the vision
Okay.
correction, how much was the glass correction, how much was the vision, and how much it has changed, why it has changed. A lot of things needs to be answered without blanket
Okay.
telling that Arabindo has changed the power of the eye. So I am
No,
not against Arabindo or anything like that, but let me tell you that the newer scientific literature does not support those exercises. Okay. Yeah.
Okay. Okay, sir. Thank you.
Thank you,
And
sir.
let me also
Shru-
tell you that there are a lot of kids who have these exercises and who are coming to me with refractive errors which are residual, which are not changed. Okay. So
Okay.
we should actually, what I was basically planning to do was to do a scientific study of what was being told, and then let us look forward from there. Okay. I'm not negating anything. It may be
Okay.
possible, but I don't have any information on that. Yeah.
Thank you, sir.
Okay, sir.
Shruti,
Thank
Shruti
you,
also can ask the
doctor.
question.
Sure, sir.
Shivaya?
Sir, I have two questions. One is regarding coolers. So, what you told, the specs which we, sunglasses.
Yeah.
I just want to ask that whether the sunglasses are good for our eyes, and when we go out, like, is there any specific range of sunglasses which we can use and all?
Yeah. So generally, there are UV. Sunglasses generally cut the visible light. Okay, visible light is not so much of a problem, but very bright light also has a lot of ultraviolet. And as you understand, the ozone layer is getting depleted and depleted, and so more and more UV is coming. But fortunately for us, we are all pigmented people. We are all darker people, and our retinal pigment epithelium is already having a lot of pigments, which will prevent us from a lot of these harmful radiations. Whereas if you look at the Western people, they are depigmented people. They don't have a lot of pigments, and so the ultraviolet related skin cancers, or the eye cancers, or even the age related macular degeneration processes caused by the ultraviolet rays are more in those people. So they are basically using sunglasses any time they go. You require sunglasses. For us, we can use in very bright light, and take care that it should basically block the UVC, UVB, etc. Okay.
Okay. So my second question is, can you say about the convergence and divergence issue, sir? Our eyes convergence and divergence issue.
So convergence and divergence issues. I did not want to
Yes.
touch on that. The strabismus part I just omitted. Okay. Now let me tell you that your eyes are generally looking straight. Can you see my video also? Can you
No,
see my
sir. Actually,
video?
I can't see your video, sir.
Oh, my video is on. Okay. So eyes are generally looking straight.
Okay.
Convergence is the process whereby the eyes converge towards a near object. Like if you are reading a book or if you are seeing a mobile, the eyes do converge.
Okay.
In eyes don't usually diverge out of the normal. Eyes don't diverge. Okay,
Okay,
eyes
sir.
converge and reduce convergence. Now let me tell
Okay.
you that when you converge, the nerve supply of the convergence muscles also supply the autofocusing muscles of the lens. So generally, when you converge, there will be accommodation. Accommodation means that the lens will become more plus.
Okay.
When the lens becomes more plus, then you will become clear for a near vision. So these two
Okay,
are
sir.
usually linked.
Okay. Sir, so if
No,
I'm
no, no.
having
Now
a convergence.
let
Okay.
me just
Okay, sir.
complete.
Okay,
Okay.
sir.
So this is a little difficult concept. I don't know whether you will completely understand. So unless you listen carefully, you will not understand. So as
Okay,
I
sir.
said, the muscles for convergence as well as the muscles for autofocus are linked to each other. So when one activity occurs, the other activity automatically occurs. There is one more activity which occurs, which is basically the pupil, the aperture of the eye also reduces in size. So these three are linked. Now, when somebody is reading a near object, you require convergence. So for this much grade of near object reading, this much grade of convergence will be there. This much grade of autofocusing, plus lens will be there. So there is a connection like that. That is called accommodation by convergence ratio. So some people may have very high accommodational by convergence ratio. And for them, whenever they look at a near object, there will be a squint. Squint means deviation of the eyes, significant deviation of the eyes. Or whenever they look at distance, they may have a squint. That is because these muscles and these activities are linked towards each other. Okay. So convergence can be. So now let me now ask your question. You had one question.
Yes, sir. Because I was having convergence issue, and whether is there any that?
Okay. It's a little more simpler question. Okay. Now convergence issue means usually you have convergence insufficiency, which means when you require to converge, your muscle is not converging enough, which means your lens will accommodate to focus on the book or the mobile or the near vision target that you want to see, but your convergence is not adequately coming in. So for that, what you require to do would be exercises. So you will have a target which you will keep at some distance, and then you will focus on it and move the target close by. That is called pencil push-ups.
Yes, sir.
That if you do 50 to 100 times every day, your convergence will become a little better.
Okay, sir.
Okay.
Okay, sir. Thank you, sir.
Okay, sir. Thank you. Harikrishnan sir also can ask a question.
Yeah, Harikrishnan sir was raising his hands multiple times. Yeah.
Okay. Namaskar, sir. Am I audible, sir?
Yes.
Okay. I have a very small question. So, in most of the digital devices we use nowadays, like mobile phones and laptops, there is a specific display mode called a reading mode, which claims to reduce the higher frequency light.
Yeah.
From which promises to reduce the screen from emitting higher frequencies like blue frequency.
Blue light is
So
basically.
I just wanted to know whether it is effective in reducing the eye strain.
Partly effective, sir. It's partly effective. It's as I said, ultraviolet spectrum would be higher frequency. Okay. So right from blue, there is a problem. So they are cutting the blue part of it. It is supposedly, like as I said, if we look at the greenery, it's a little more cooling for us. So green is a little more higher frequency, lower frequency in the VIBGYOR. So B is higher frequency and G is lower frequency. That is probably the thing. So when you cut the blue light, it is a little more comfortable to the eye, but it would not completely negate the effects of computer vision syndrome or mobile vision syndrome.
Okay, sir. Just wanted to know whether it is effective. It will be effective for the students to enable this reading mode during the online classes.
It is better to be enabling that, but it would not completely solve the problem or anything like that.
Okay, thank you, sir.
This webinar has been very useful and an eye-opener to all of us. Thank you so much, sir.
Thank you very much. Thank you very much for giving me this opportunity also. And I thank Kannan sir and all of you. Thank you very much.
Now, let me invite Sri M. Ramachandran, Faculty, Department of Cultural Education and India Studies, to give the vote of thanks.
Om Amrita Namaha. I take this opportunity to thank first and foremost our speaker, Dr. Gopal S. Pillai, HOD Ophthalmology AIMS, who gave us a wonderful insight on eye care. ശരിക്കും പറഞ്ഞാൽ കണ്ണിനെ കുറിച്ചിട്ട് കവികളും എഴുത്തുകാരും ഒക്കെ ഒരുപാട് പറഞ്ഞിട്ടുണ്ട്. ഈ വിഷ്വൽ മീഡിയ സ്റ്റുഡൻസ് കൂടുതലുള്ളത് കൊണ്ട് സിനിമയുടെ കാര്യങ്ങളിൽ അവർക്ക് അറിയാം. ശംഖുപുഷ്പം കണ്ണെഴുതുമ്പോൾ ശകുന്തളയിൽ നിന്ന് ഓർമ്മ വരുമെന്നാണ്. കണ്ണ് എഴുതുകയാണ് പുഷ്പം. കണ്ണിന് അത്രമാത്രം പ്രാധാന്യം ആ കാലഘട്ടത്തിൽ വരെ കൊടുത്തിരുന്നു എന്നുള്ളത് ജസ്റ്റ് ഒന്ന് ഓർമ്മിപ്പിക്കുന്നത് മാത്രമേ ഉള്ളൂ. താങ്ക് യു ഡോക്ടർ. I would next like to thank our director, Dr. Krishnakumar sir, for his support and guidance in making this event happen. I would also like to thank Kanan sir of social media, whose great effort was behind in organizing this event, and Jyotish Mai sir of Cultural Department for comparing. I also thank visual media student Kumari Ritika for her graceful hymn of prayer. I also thank my colleagues and students of ASAS for taking part in this event and making it successful. May Amma bless us. Om Amrteshwari Namah.
Thank you, sir.
Thank you very much.
Now we shall end the session with Shanti Mantra. Request Rishika.
ഒരു മിനിറ്റ് ജ്യോതിഷ് സാർ.
ഞാനിന്ന് വീണ്ടും താങ്ക്സ് പറയാണ്. ഡോക്ടർക്ക് അറിയാം.
അല്ല, എനിക്ക് ആക്ച്വലി ഇൻഡിക് സ്റ്റഡീസ് ഒക്കെ ഉണ്ടെന്ന് അറിഞ്ഞതിൽ വളരെ സന്തോഷമുണ്ട്. കൾച്ചറൽ ഇൻഡിക് സ്റ്റഡീസ്. ഞാനിപ്പം സരസ്വതി സിവിലൈസേഷന്റെ ഇത് വായിച്ചുകൊണ്ടിരിക്കുകയാണ്.
ബാക്ക്ഗ്രൗണ്ടിൽ കാണുന്ന പടം സരസ്വതിയുടെ മ്യൂറൽ പെയിന്റിംഗ് ആണ്. അവിടുത്തെ ഒരു കുട്ടി വരച്ചത്. 7 years, 2007 she completed the course, she drew it and presented it to me.
ഇപ്പൊ ഒരുപാട് ബുക്കുകളും കാര്യങ്ങളൊക്കെ വന്നു തുടങ്ങിയിട്ടുണ്ട്. എന്നാലും നമ്മളുടെ കരിക്കുലത്തിലൊക്കെ മാറ്റം വന്നിട്ടുണ്ടോ എന്ന് എനിക്ക് അറിയില്ല. ആര്യൻ ഇൻവേഷൻ തിയറിയും ഈ കൊളോണിയൽ ഒരുപാട് ചേഞ്ചസ്
in our cultural education syllabus. It is there. Mentioning of that. So നേരിട്ട് കാണാൻ എപ്പോഴാ പറ്റുന്നു. We will chant Loka Samasta Sukhino Bhavantu 3 times. Then Om
Lokaha Samstaha Sukhino Bhavantu. Lokaha Samstaha Sukhino Bhavantu. Lokaha Samstaha Sukhino Bhavantu. Om Shanti Shanti Shanti. Om Shri Gurubhyo Namaha. Hari Om.
ഡോക്ടർ ലോഗ് ഔട്ട് ചെയ്യട്ടെ?
Yes, sir.
ശരി. ഓക്കെ, താങ്ക് യു.